good morning to our Prof. So today, my name is Muhammad Arfan Muhammad Zaki. So today I will be demonstrating the procedure whereby we will be doing Pap Smear. Okay. So I will go through the details on what we're going to do today. So the first thing is that we want to confirm the patient's details. Make sure it's the right patient. All right. And then I would like to explain to the patient in terms of the consent taking. We want to explain what we're going to do. All right. So basically, this is to take a sample from the cervix itself. So whereby we'll be using a cyto brush, and we will need to use a speculum that will be inserted via the vagina to visualize the cervix, and from there we will take the sample from the patient. And of course, we will explain the benefits and risks that will be involved. All right. So some of the benefits will be that we'll be able to take the sample from any possible lesions for us to confirm the diagnosis of the patient. And then some of the risks that might be involved, the patient might have some slight pain or discomfort. They can also have some bleeding after the procedure. So I need to explain this to the patient clearly. All right. And then to do this, there will be two ways that we can do actually. Either using a cytology brush, or a wooden spatula. And for today, I will demonstrate using a cytology brush technique. So, this thing first, make sure that we wash our hands, sanitize it, and wear proper PPE, gloves, apron, and your goggles or face. Okay, so now I will run through the things that we need to prepare for this Pap Smear procedure. So what I need, first thing first, to clean the perineal region of the patients, I will need some sterile water and some cotton buds. Okay, and then of course we need the speculum. This will be inserted through the vaginal canal to visualize the cervix. And then I will need the cyto brush. This cyto brush is used to collect the specimen from the cervical outer cervix. Okay, and this is basically for demonstration purposes. This is an example of the ectocervix of the patient. And we have the container for our specimen. Later will be, once we collect the specimen with the cyto brush, we will reject it and put it inside this container. And then some lubricating gel basically. We will be lubricating the speculum once I will insert it into the patient's vaginal canal to ease the procedure in general. So first thing first, ideally I will need a female chaperone to accompany me during this procedure. Of course, so now I would ask permission, okay puan, saya akan buka lahan sikit bawah ni. I will expose the perineum region. Now once I expose, first thing I would like to clean the perineal region using cotton swab and sterile water. So make sure when you clean it, do it in one direction, anterior to posterior, and then discard. You discard the cotton, take another one, clean it. Okay, direction, and the other one. Alright, so once it is clean, we inspect the perineal region, the vulva, for any obvious abnormalities, any bleeding, any discharge, or any masses, visible masses. Alright, so we will proceed with the insertion of the speculum. So take a speculum and put some lubricating gel. Okay, this is to smoothen and ease the procedure. Okay puan, saya akan mula masukkan speculum ni. Mungkin dia akan sakit ataupun tak selesa sikit lah. Nanti kalau sakit beritahu saya puan, boleh ya. So ask permission to insert the speculum to the patient. Okay, so carefully we insert it. Okay puan, saya masukkan insert the speculum, and then you rotate it until the handle is directed over the 12 o'clock or anteriorly, and then you open the speculum and make sure you fix it, you screw it in place. Alright, okay, now as you can see, once we put the speculum in place, we can actually visualize the cervix or the ectocervix of the patient. And again, look for any obvious abnormalities, any mass, any bleeding, discharge. Alright, okay. So once we've inspected visually the cervix, we'll proceed with the specimen collection. What we need is the cytology brush. Okay, so as you can see, I will be inserting the cyto brush inside within the speculum. Okay puan, saya nak ambil sampel sekarang puan. Mungkin ada rasa tak selesa atau sakit sikit lah. So make sure that the brush does not contact the surface of the speculum, and then you reach until you reach the external cervix, the ectocervix. Okay, so from here you rotate it clockwise about 5 times, to collect the specimen, and then you remove it. Okay, so for demonstration purposes, I will be showing you what happens within the inside on the cervix. So this is a sample cervix, okay, for demonstration. This is your brush. So we want to collect the specimen over here within the external os. Okay, so put it inside, and then make sure it contacts with the cervix, and then you rotate the brush clockwise about 5 times. Okay, so once you've collected your specimen, you take your specimen container, open it, and then you discard the specimen inside the brush. Okay, and you close it, you send it to the lab for further evaluation. Okay, so now you're done with it, you want to remove the speculum. Okay puan, sekarang saya nak buka speculum tu. Mungkin sekali lagi lah, mungkin ada tak selesa atau sakit minta maaf puan Okay, so you unscrew it, unscrew the speculum, close it, and then carefully you remove it. It's a reversal process as how we inserted it before. Okay, okay, so once the speculum is out, you cover back the patient. Okay, and then you thank the patient. Okay puan, dah selesai untuk prosedur ni. Okay, so then I explain to the patient. So after this, she might be experiencing some vaginal spotting or bleeding, which might be a known complication from this procedure, but it's nothing to be worried about. We need to reassure the patient, and of course we follow up the patient for us to discuss the results of the Pap smear once the lab has run its diagnostic test to follow up regarding the patient's condition. So with that, thank you, Prof.